Okay, now today is still Thursday, June the 28th, 4:45 p.m. Part 2 of the video, cotton in my mouth and dental pain. Anyhow, just changed the little cotton gauze, so I put a new one in. So let me show you a picture of what's been going on with me, since some of you, pretend this is my mouth, okay? So the dentists have their moment with me, trying to promote them because of their mistreatment of me. Okay, so this is what the mouth is. So pretend there's a teeth at the back of the mouth on my left hand side, well, this side right now facing the camera. And that would be the second molar from the back, called number 36. Right from the dental standpoint of view, it's rotting. It has a post in it that has shifted. It has no cap on it. And it has an infection that is actually traveling down my throat and into the mouth, and creating all kind of problems like earache, sore throat, chest pain, and what else can it do? Oh yeah, the brain actually can't think straight when it's in pain, and it actually can't formulate even thoughts properly. So I'm doing remarkably well. It must be due to the great care I'm taking at home of looking after myself. Now this is called a dentist post. So if I go to the dentist and ask the dentist to take out the offending teeth, then there'll be a gap between the two teeth, the back molar and the one in front of it, or in between. So then the dentist will wait for the hole, to kind of heal enough once the extraction has happened, and then he'll put in a metal post in with a fake tooth on it, which I've been trying to avoid since 2008. I'd rather they just retreat the tooth, which is they clean the infection, remove the post if it needs be, put it back in properly if it need be, put a cap on. That's work. That's almost 2 hours worth of surgery. And you need a competent dental surgeon to do that. The one who feels confident that he or she can actually clean the infection, remove the post without breaking the teeth, put it back in properly, or put a new one that's compatible with my mouth. I won't get sick, put a cap or a crown on it, and then we're finished. Now to do that, that costs money. Not all dentists can afford to do that for free for their patients. And I can't afford it either. Now ODSP, that's the Ontario Disability Support Program, can actually afford it for me under special circumstances. But to do that would require a worker who would actually do her or his job and actually know the rules that they're supposed to know, the rule books they get on behalf of their client, and actually approve it. To do that, they'll have to read it, and then they'll have to find out the special circumstances that I qualify under. To do that, that's like a lot of work, which none of them have been able to willing to do between 2008 and now, or nor do they have the competence. Or maybe they have the competence. They figure, well, Znaimer, aside from being disabled, she's a writer, so let's jerk her around a lot. Let's drag things out for her. Maybe she'll write about it, and then and people will feel sympathetic for us that how much work an ODSP worker has to do, that they really don't have time to actually know the things that they're supposed to know on behalf of their clients to do their jobs. And also I'm supposed to feel sorry for the dentists too, that how hard they have work and they get paid very little, according to the ODSP fee schedule and the fee schedule of the Ontario Dental Association. I just really know life is very tough for them. And then of course they get bad clients like mine who may be actually poor and may not be able to afford to pay them. Or maybe they can afford to pay them, but they still like some respect from them. And when they don't get the respect, they just say, okay, adios, maybe I'll see somebody else. But maybe they treat rich people like this too, or maybe they treat middle class and lower middle class people like that too. But who cares? This video is all about me and my medical good treatment or bad treatment. And I guess all of these people who wanted little freebie lobbies or publicity from me, they got it. They got it. But am I going to do any raising for other poor people? No. Am I going to do any fundraisers for my dentist? No. Am I going to help them with their tuition fees? No. Because one of the main things I've learned over the last 8 years, which I had not learned before very well, was how to be selfish, how to be self-centered, how to look after for number one. And when I say number one, that's just yourself. And basically ignore other people, and it's very unprofessional to show kindness to people, very unprofessional to do free work for them, very unprofessional to come up with an appropriate payment plan if they can't pay you. Especially the poorer the person appears, the more strict and hard we should be on them when it comes to money. Yes. So that's really good mistreatment or good treatment that I hadn't learned at my university studies and college studies and night school studies. Goodness gracious. Or maybe I did and I'd forgotten. So this was a refresher course I got recently. That's not to say that there are other naive people out there who actually do things for free for people, or who actually reduce their fee schedules for people, or who actually, I don't know, try to work with them. I don't know. Those people are out there. I just have to find them. And unfortunately, I'm not out very much when I'm sick, so I guess they'll just have to come and find me. Okay, this is it. So I have to not do part 3.